And today we're going to be doing Botox for Lisa here today. Botox is a medication that's injected directly into certain muscles in the face to relax them. The reason why we use Botox is certain movements repetitively over time will cause wrinkles in different areas in our face. The common areas where we get Botox is for the 11 lines between the eyes. So Lisa, can you bring your eyebrows together for me? And she still has a little bit in, but when you get the lines right there, you use a little Botox right there. When you raise your eyebrows, the lines across the forehead, if you keep moving those, you get some lines along here, so Botox will be injected in these muscles up here. And also in the crow's feet, so smile real big. And these little fine lines and area on the sides of the eyes for the crow's feet. And so we're going to inject Botox directly into these muscles. And then it's going to temporarily weaken them. And then it's going to allow the skin to relax and for those wrinkles to soften and go away over time. So Botox is done very easily and simply. I've already cleaned off her skin with some alcohol. This is injected with the tiniest needle that there's made out there. And people very rarely feel this. I almost pinch the skin right here, so they can barely feel it. And then it just goes in, and then you just kind of gently inject it. And that's all it is. And so for Botox, for the 11 lines, there's 3 muscles that we're injecting. There's one muscle here called the procerus, and there's a paired muscle on either side called the corrugators. And those are the other muscles we're going to be injecting. Now Botox does not work immediately. It takes about 5 to 7 days for Botox to really start to kick in. And it's temporary. So Botox will last anywhere from typically 3 to 4 months. Some people are lucky and it may last them a little bit longer. Now when I do Botox here at Carolina Facial Plastics, I mix all my own Botox myself. So that way I have control over the entire process. And I get consistent results because I'm the one in charge. I'm doing all the injections, doing all the mixing. So it just creates a more predictable result. Now for her forehead, everybody's forehead wrinkles a little bit differently. You can imagine some people have very short foreheads, some people have very tall foreheads. Some people have, everybody's muscles differently. So raise your eyebrows for me. Raise your eyes real hard. And you can kind of see where her muscle is. And everybody's muscle is different. Some people don't have any muscle here. Some people have muscle here. Some people just have muscle out over here. So you can relax for a second. So looking at her movement, I use these dots to identify specifically for Lisa where I wanted to inject her forehead to get her the best results. Also for the forehead, depending on where we inject it, we can raise the eyebrows, we can lower the eyebrows. So there's really is a lot of technique that goes along with, especially injecting the forehead region in relationship to our final brow position. And as you can see with Botox, you're going to see these tiny little bumps, little mosquito bump looking places. And these are going to last anywhere from about 30 to 45 minutes, and then they're going to go away. And smile for me real big, Lisa, and then relax. And then with Lisa and everybody, I'm always looking. I can see a little blood vessel here, so I certainly want to stay away from that. I don't want to limit any chance of any bruising. And so you can see Botox is just barely underneath the skin. The needle slides, and it forms a little tiny bump. And then that's completed this side. And of course, we're going to finish doing her forehead and the crow's feet on the other side. But a Botox is done at Carolina Facial Plastics to relax the muscles that causes the fine lines and wrinkles, most commonly for the 11 lines between the eyes, for the forehead lines, and the crow's feet. Thank you very much.